Hello everyone, today we are going to talk about coronary interventions. Have any of your parents or relatives had a heart attack and then needed a surgical intervention to widen the blocked coronary arteries? Given the prevalence of this condition in modern population, new techniques for treatment of patients are highly warranted. When coronary artery disease causes chest pain or heart attack, percutaneous coronary interventions such as angioplasty alone or with the stent can restore the blood flow to your heart. In this video, we'll be talking about coronary intervention, the reason for resorting to it, how it's performed, and what are the possible interventions for it. So our role today is to answer most of your questions regarding coronary interventions. Today we have Dr. Lee, who is a leading doctor at Seoul St Hospital. He's going to discuss with us everything about coronary interventions from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good morning, Dr. Lee. Very nice.
Good morning.
So, Dr. Lee, today we'll be talking about the coronary intervention.
Yes.
So, what is it exactly?
Coronary stent procedure is a procedure in which blood vessels are expanded using a metal net called stent in the narrowed area when the heart vessels are narrowed. Insert a long tube through a wrist or leg vessel. Position the tube at the entrance of the cardiovascular system and insert a stent through it. And proceed by expanding the stent placed in the narrowed area.
So, what is exactly balloon angioplasty?
Balloon dilation is a procedure that helps the stent fit well and the stenosis widen well before stent intervention. Before the mid-1990s, when there was no stent, balloon dilation was only performed, but now balloon dilation is mostly performed before the stent intervention as a pre-treatment.
So, for what disease the cardiovascular system or coronary intervention is necessary?
When cholesterol sticks to the walls, the blood vessels in the coronary arteries that supply blood to the heart and narrows the coronary arteries, the blood vessels become a time bomb-like condition that you don't know when they will be blocked. This is called atherosclerosis, and a condition in which the stenosis progresses and blood supply to the heart muscle is insufficient is called angina, and a condition in which blood vessels are completely blocked and the heart muscle begins to necrosis is called myocardial infarction. When you have this symptom, not performing a stent procedure to pierce blood vessels can cause serious sequelae in the future and increase your chances of dying. Therefore, when you have chest pain or shortness of breath, it is important for the patient to visit a medical institution and take appropriate measures through a thorough examination.
So, why is this method better than normal surgery?
Coronary stent procedures take less time than surgery, and there are fewer wounds or complications immediately after surgery. In general, the procedure takes about 1 to 2 hours. If the procedure proceeds without any problems, you'll be discharged the day after or the next day after the procedure. Therefore, if it is not non-adaptive, the doctor primarily recommends treatment, not operation to the patient. However, in the case of very severe conditions you have or multivascular disease, surgery may be performed by bypassing the heart by connecting new blood vessels that can replace the narrowed coronary arteries. In the case of bypass surgery, it can be considered if you have diabetes and multivascular disease together, or if the procedure is difficult due to frequent liver lesions and severe calcification, and if the patient has undergone stent treatment in the past and the disease reoccurs extensively.
So, what is coronary stent and how long does it last?
The coronary stent is basically made of metal, and the stent remains in the blood vessel after the procedure. Stent is not removed because the flesh grows inside the stent over time. Recently used drug stents are applied with anti-cancer drugs. It continuously inhibits the proliferation of heart, arteries, and muscle cells to prevent stenosis.
Are there any risks to this kind of stent?
Complications of stent procedures include leakage, rupture of blood around the stent, exit of the stent from the desired location, blocking blood flow through the stent, and infection.
How about the recurrence of arterial stenosis?
After a stent insertion procedure, blood clots and fat may accumulate again in the stent after a certain period, resulting in stenosis in the stent again. There are differences in degree depending on the type or length of the stent, but the reoccurrence rate of drug stent procedures is an average of 5 to 10% per year. If the patient arbitrarily stops taking the drug, the blood vessels will be clogged again with a higher probability. In particular, patients with myocardial infarction are more likely to have blood vessels blocked again in the future than ordinary people, even if they recover after receiving good treatment. Therefore, these patients should be treated more thoroughly.
So let's talk a little bit about the contraindications of this kind of stent.
If the patient's life expectancy is seriously small due to antiplatelet treatment or comorbid diseases of the organs after stent intervention, coronary stent intervention is not performed.
So the anticoagulant adjunctive therapy after a stent. Tell us a little bit more about it.
Yeah.
All stent patients should take antiplatelet drugs in the long term or for life. When expanding blood vessels, damage to blood vessels can occur, and in the long run, blood clots can occur as stents are exposed to blood vessels. Proper use of this antiplatelet drug can reduce the probability of the complications. 2 antiplatelet drugs should be taken for 6 to 12 months after stent treatment, and at least 1 antiplatelet should be taken for life after that.
I will ask you a little bit more about the rehabilitation and lifestyle after coronary intervention, especially on the arteries of the heart.
Even if blocked vessels are reopened through coronary artery insertion, patients with myocardial infarction may have deep challenge complications that reduce heart function. In particular, the longer the vascular closure period, and the larger the range, the more severe the complications are. And in some cases, recovery is impossible. In this case, active medication and cardiac rehabilitation exercise treatment immediately after reopening play an important role in restoring the patient's heart function.
So my last question, how can you prevent this kind of coronary heart disease and myocardial infection?
Coronary intervention does not cure cardiovascular disease, but merely overcomes the crisis immediately. Not only the area pierced by the procedure, but also other areas can be blocked again at any time. So improvement of the patient's lifestyle must be accompanied. It is important to thoroughly manage various causative factors such as diabetes, high blood pressure, and hyperlipidemia. Moreover, patients should try to eliminate risk factors that can be changed, such as poor eating habits, lack of exercise, and smoking. Usually, patients should eat low salt or less greasy food and quit smoking, and exercise, such as walking, must be combined.
Thank you so much, Dr. Lee, for your time.
Thank you very much.
Today we learned many things about coronary intervention, and the doctor explained in details everything related to this life-saving intervention. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.